All right, let's talk about a class of medications that completely changed the game. They started out as diabetes drugs, but they ended up doing something so much bigger, revolutionizing how we protect our hearts and our kidneys. They're called SGLT2 inhibitors, and honestly, they're one of the most exciting breakthroughs in modern medicine.
For the longest time, the main goal of diabetes treatment was pretty simple. Just get the blood sugar down. But what if a single daily pill could do way, way more than that?
I mean, what if that same pill also acted like a personal bodyguard for two of your most important organs, actively shielding your heart from failure and protecting your kidneys from long-term damage? Well, guess what? They are real. They're called SGLT2 inhibitors, and their discovery has been nothing short of a revolution. Let's dive into why doctors and patients are so excited. So, what exactly are these things? Well, you can think of them as the Flozin family, because that's what all their names end with. You've probably heard of the big three, Jardiance, Farxiga, and Invokana. They're all just a simple once-a-day pill, but what they do inside your body is totally different from almost any other medication out there. And that brings us to how they actually work. See, most diabetes meds focus on insulin in one way or another. These don't. Instead, their target is your kidneys. The idea is actually pretty brilliant and surprisingly simple. So, your kidneys have this protein called SGLT2, and its job is to grab sugar from your urine and pull it back into your blood. These drugs just block that protein, and the result? Your body literally just pees out the extra sugar it doesn't need. Now, that one simple action creates this amazing ripple effect. First, obviously, by getting rid of sugar, you lower your blood glucose and your A1C. Second, you're also losing the calories that were in that sugar, which leads to some modest weight loss. And third, because sugar pulls a little water and salt out with it, you get this mild diuretic effect that helps lower your blood pressure. So that's three huge benefits from one single clever mechanism. But here's where the story gets really incredible. The effects on blood sugar, weight, and blood pressure, doctors kind of expected those. What they discovered next, though, it absolutely shocked the entire medical community.
It all started back in 2015. Researchers were studying Jardians in a huge trial, and really, they were just trying to prove that it was safe for the heart. But what they found was so much bigger than that. They found a 38% reduction in death from cardiovascular causes. Let me say that again, 38%. For a diabetes drug, a number like that was just unheard of. It wasn't just safe, it was incredibly protective. This one finding changed everything. And the evidence just kept piling up. Trial after trial showed that these drugs could slash hospitalizations for heart failure by about 30 to 35%. They help the heart by reducing fluid overload and improving its overall energy use, basically taking a huge strain off the organ so it can work more efficiently. Now, just pause and think about this for a second. The benefit for the heart is so powerful that these drugs are now prescribed as a primary treatment for heart failure, even in people who don't have diabetes at all. That is the definition of a paradigm shift in medicine. But the story doesn't even stop there. After the heart discovery, researchers soon realized that these drugs were delivering another massive breakthrough, this time for the kidneys. A landmark study called the EMPA kidney trial found a 28% reduction in the progression of kidney disease. It turns out that by changing the fluid dynamics, these drugs lower the pressure inside the kidney's tiny filters. It's like a shield, dramatically slowing down damage over time.
Okay, so the benefits are clearly massive, but like any medication, we have to look at the full picture. So let's talk about the other pros and, of course, the potential cons and side effects. One of the biggest practical upsides is weight. So many other diabetes medications, like insulin, can actually cause weight gain, which can be really frustrating. SGLT2 inhibitors are one of the only classes that do the opposite. They help with modest but sustainable weight loss. For a lot of people, that is a huge win. All right, now for the side effects. Because you're peeing out sugar, the number one thing to be aware of is a higher risk for genital yeast infections, since sugar is basically food for yeast. So good hygiene is really important. You might also see a slightly higher risk of UTIs, and you'll definitely notice you have to go to the bathroom more, especially at first. That's why staying well hydrated is absolutely key. Now, serious side effects are very, very rare, but they can happen. The main takeaway here is just to have a really open conversation with your doctor about your personal health history to make sure it's a safe and smart choice for you. So, this brings us to the big question. How do you know if one of these medications might be a good fit for you? This is all about feeling empowered to have a really informed chat with your doctor. The official medical guidelines are now crystal clear on this. If you have type 2 diabetes and you also have established heart disease, heart failure, or chronic kidney disease, then these drugs are strongly recommended. And here's the most important part. This is recommended regardless of what your A1C is. This has moved beyond just being about blood sugar. It's about protecting your organs. This quote from the treatment guidelines just says it all, doesn't it? The entire goal of diabetes care has shifted. It's not just about managing blood sugar anymore. It's about proactively preventing the most serious heart and kidney complications. So I'll leave you with this question. Could an SGLT2 inhibitor play a protective role in your health story? That is a conversation worth having with your doctor. And if you do decide to start one, tracking your response with a tool like My Gheware can be really helpful because it lets you and your doctor see all the trends in your glucose, your weight, and more, all in one place. And of course, our very important disclaimer, this is for your information and education only. Any decision about medication has to be made in partnership with a healthcare provider who knows you and your medical history. Thanks so much for joining me for this one.